Chapter 5. High Dose Vitamin C, Nature's Cancer Answer. Toxic Tissues Gone Mad. Since President Nixon declared war against cancer nearly 40 years ago, U.S. taxpayers have spent billions upon billions of dollars on cancer research. What has that brought us? Cancer researchers tell us that survival rates are better now. That's good news, but the improvement cannot be attributed to superior treatment methods and drugs. A recent report from the Centers for Disease Control credits much of the positive change to early detection and lifestyle modifications. In addition, there's a commonly misunderstood factor that further distorts the picture. A cancer survivor is defined as a patient who lives beyond the fifth year, even if death from cancer occurs a day later. Fact is, cancer deaths are at an all-time high. Even by the most optimistic of appraisals, we are not winning the war. Why? Perhaps we're fighting the wrong enemy. Lesions and tumors are the visible evidence of cancer. They appear when normal cells go mad and begin to malfunction and multiply in a way that is detrimental to the body. Conventional protocols attack these malignant tissues with surgery, radiation, and/or chemotherapy. If and when these diseased tissues disappear, the cancer is said to be in remission. Frequently, to everyone's dismay, the cancer returns. This is why oncologists never use the word cure. Healthy cells, by definition, are not diseased, nor do healthy cells cause disease. All disease starts when healthy cells are damaged and cease to function normally. So why wouldn't we expect cancer to return if the factors that push normal cells into a malignant state are never addressed? The real enemy, then, is whatever causes the malignant change in the first place. Interestingly, the American Cancer Society has a realistic grip on what causes cancer, even though its purported pursuit of a cure has been completely futile. Although the American Cancer Society asserts that cancer is a complex group of diseases with many possible causes, it seems to understand that toxins and pathogens are always the root cause of cancer. It divides the risk factors into 5 areas: genetics, tobacco, diet and physical activity, sun and UV exposure, and other carcinogens. This is hardly an exhaustive list, yet an effective treatment would certainly need to address all of these areas and more. Interestingly, most of these causes are related to toxins and/or pathogens. Of course, toxins and pathogens are both best treated with high-dose vitamin C. Let's examine some of these causes a little further. Genetics. A predisposition to develop certain cancers can be passed on genetically. However, the actual disease is not inherited. Although not a direct cause, an inherited propensity weakens the body's ability to defend against cancer-causing agents. For example, an individual may be lacking an enzyme that helps to naturally neutralize a significant toxin. Tobacco. This substance, along with many other legal and illicit drugs, contains multiple toxins and is clearly linked to the development of cancer. Diet and physical activity. The American Cancer Society proposes that poor lifestyle choices contribute to cancer risk. As the lifestyle issues are examined, it becomes clear that toxins and pathogens are the final common denominator of that risk. Some dietary choices introduce toxins, such as pesticides or food additives, into the body. As well, wrong food choices can inhibit the body's ability to neutralize and/or eliminate toxins and its ability to keep pathogens at bay, primarily through immune system damaging nutrient deficiencies. A lack of exercise also suppresses the body's defense system against toxins and pathogens. Sun and UV exposure. All radiation, whether from the sun, tanning beds, diagnostic equipment, radioactive contamination, or other sources, is a known carcinogen. Although radiation may not look like one, it still damages cells and tissues just like a toxin, depleting electrons from vital biomolecules. See Resource H, radiation. Other carcinogens. The American Cancer Society rightly identifies toxins and certain pathogens as cancer-causing agents. Metastasis. One of the causes not mentioned by the American Cancer Society is cancer itself. Oncologists call it metastasis. This process occurs as cancer cells from one tissue break into the blood or lymphatic vessels and move to a new site and initiate cancer there. Since most, if not all, cancers begin through toxic exposure, pathogenic challenges, or metastasis, it follows that a cure would have to address all three causes. In addition to removing all known pathogen and toxic exposures where possible, the strategy must administer a safe and effective universal antimicrobial pathogenic causes. That's number one. Number two, ultimate antidote for toxic causes. Number three, agent that strengthens blood and lymphatic vessels for metastatic causes. Number four, agent that selectively kills cancer cells from metastatic causes. And number five, an agent that selectively strengthens healthy cells for all causes. Vitamin C has already been shown to be a universal antimicrobial, Chapter 1, and the ultimate antidote, Chapter 2. It is required to keep blood vessel walls strong and healthy, Chapter 4. Studies that will be discussed in this chapter also show that vitamin C selectively kills cancer cells and simultaneously strengthens healthy cells. No other substance can make these claims, thus proving that nature's powerful cancer answer is high-dose vitamin C.